Senator Michael Bennet of Colorado criticized President Trump on the Senate floor, saying under his leadership, universal health coverage is impossible. He also warned young adults who lose their parents' insurance at 26 could be left unable to afford coverage.
I guarantee you this, as long as we have President Trump and the White House and a majority of the Republicans in this chamber, we will never have political leadership that's fighting for universal health care, that's fighting for a public option that can be available to every single family in America. By the way, that's my proposal. It relies on everybody in America to make the best choice for their family. It's not something that would be imposed from here. It'd be the chance for every family to say, you know what, I'll stay with the private insurance I have, or actually I'd rather be on a system that's run by Medicare, where I know I'm going to have access to mental health care and health care for my family in a predictable way. And I'll just close. I can see my colleague from Massachusetts. I'll close by saying my heart especially aches for young people across this country, the people the age of my own daughters. I had a young woman ask me the other day, a recent graduate of Western State in Gunnison, Colorado. She said, I'm coming off my parents' insurance when I'm 20, after I'm 26. You'll remember we put that in the health care bill. Before that, there was no opportunity for people to stay on their parents' insurance. We did it. We said you get to stay on until you're 26. But then she said to me, Senator, what am I supposed to do? Take 2 or 3 jobs to pay for my health insurance when I have to come off my parents' insurance? And I said, that is exactly the right question. That is a question that 26 and 27 and 28-year-olds are not having to ask in any other industrialized country in the world, only in the United States of America. Are we running a system where young people in their 20s have to decide between health insurance and their rent, or health insurance and food, or health insurance and the ability to put some money away to save for a house? And we should change that. I believe strongly that if we ever get to the point where we're expanding Medicare in this country, we should do it for the younger kids that are in their 20s first.
For more congressional news, stay tuned to Congress Clips, and thanks for watching.